Devo fare anche loro?
Sì, dobbiamo parlare tutti. Lei lo mette dove crede che poi noi ci adeguiamo. Vedete un po' voi, insomma, non è un problema. Can we wait one more minute so if someone would like to come? Or we can start. What do you think? Let's start. Okay. Thanks to come here. This is the session of alternative for antibiotics to exist, and if so, which are the most promising. We know that in the past we used several antimicrobials. Now the situation is a little bit changed. We still have antibiotics, but we cannot widely use, and so we need to look around and to find something new. We used for several years zinc oxide. Now it's finished also this era, and we need some products that can help us. And so some products are already on the market. We can have acids, we can have polyphenols. We could see this morning several products that are in trial or on trial. And so especially on the control of the gut, maybe also with probiotics, and so on. We have several products. Maybe on the most of the research is on the control of the gram-negative, and we need to have something more on the gram-positive. So I would like to ask you if you have some experience in this case, and I'm quite sure, looking at the people that are in this room, that they have a very big experience on this. And so I would like to ask you if someone would like to take the chair and maybe give us his experience in research or in field regarding this topic. So alternatives on antibiotics. In the chat. Do you have a question? No. Or a comment? No, I don't think so. So maybe I will try to, which is the difficult to find alternative products. We are quite used with use a product that is a solving problem, and the alternatives are not solving problem, but just something that can help to work on this situation. So maybe they can prevent the multiplying of the bacteria. Maybe they can create in the gut an atmosphere that is not really nice for enterobacteria, for example. So we modified a lot the way how to feed the animals. We started to introduce different products, but now I think we reach some target, and we can consider to work in this way with, for example, acids. Acids can modify the pH of the gut, and so if you modify the the pH, you can have a different area where the Enterobacteriaceae are not very well distributed. They can grow less and so on. Hans, if you'd like to.
Can I speak up? Can you hear me then? So I don't know anything about it. I'm just a simple animal welfare scientist. But in the project, we very often confuse curative with preventative medication. Not deliberately, but maybe it's also because there is a sort of, when we look at the alternatives, there is a sort of fading from one into the other. When you ask about conditions in the stomach, then I think of preventative measures. You started your question with a cure for against bacteria, medicine against bacteria. Then I think of curative measures, and maybe it's good to make clear where prevention stops and curing starts, or something like that.
Very good point, because in our mind we are always used to doubt. I need to treat, I need to cure. In reality, now we are not very facing products that are for treatment, but the most are for prevention. And why prevention? Prevention because we are trying to build a different model of development for the microbiome, for the gut, and so on. So I think it's really important to underline that we need to have a different point of view and try to consider that some of the tools that we are using in feed or in water are not just to treat the animals, but just to neither prevent, but just to help the animal to feel better, to grow better, and to have a low possibility of developing the disease. So this is very close also to resilience that we spoke this morning, and that need to be a very important point of view also for farmers to explain that they cannot have the same expectation for these products than antibiotics, because that is just have a problem and the antibiotic is like a hammer and you use it. But we lose the hammer, we don't have it, or if we have, we need to use when we need it. And so we just also to change our mind. And in all these things, the mind is very important.
Is this true? Because zinc oxide was used exactly like that. It was not used, we used preventative doses. So I think the mindset for using preventative doses is already there. People expect to see preventative things as well as therapeutic doses. So I'm not sure what you're saying is absolutely true.
Maybe I don't think to have the truth, but a different point of view, and this moment is just to exchange point of view. Yeah.
I have two things actually. Someone in the chat said that the person audience are not that well to hear, so please speak up. Maybe we can remove this thingy.
But there is, I think we cannot move a lot. Maybe we can ask for a mic because. Okay.
Yeah, this is how we did it yesterday. Yeah.
It was not a technical question, but just. It's Salvatore.
Already.
Can you hear us? Sorry, just maybe you can. Sorry, Salvatore, you raised your hand. You like?
Yes. No, sorry, we couldn't hear it very well. So I don't know if we were talking to me already, or so apologies if I didn't hear you. So no, I am. It was a very interesting chat, and as far as I go, I have a few points, if I may. The first one is I agree with Elias when he says that some of those approaches that are used as alternatives are already there and are already used as an preventative, and not just to go there and attack in case of infection, such as it says, zinc oxide. And that is following up on my talk in the morning, and also one of the other points. I think that the point that is missing here is to consider the whole ecosystem of symbionts in the gut. And when we talk about depleting one species or attacking one species, we miss the point of what that species meant for the community and what that modification will mean for the whole host gut microbiota system, and what that will mean for the host at the end. Because we see that sometimes it's not just decreasing the concentration of Enterobacteriaceae, for example, that decreases the diarrhea in winning pigs, but is improving the gut health in general. So that host microbiota connection that increases the health and therefore welfare at the end. The other point I'd like to follow up on is about acidification, and it's mostly based on observations after partially after the trials that I was mentioning in the morning, and is about being careful that when we play with the pH, especially when we go farther away from what is considered physiological pH throughout the gastrointestinal tract, then this dysbiosis that we might eventually cause is what is causing eventually further problematics. I think that when we have this beneficial pH variations are usually from the microbes, and therefore, for example, if we look at the Zika or the cecum, depending on the animal, we see that sometimes we have a lowering down of the pH, but due to an increased fermentation and therefore increased production of short-chain fatty acid, for example, and that's good. But we actively aim to reduce the pH, then is that where we can create problems. And there are studies that show that by decreasing the pH, we switch the production of fatty acid to more acetogenic from butyrogenic, for example. So we need to keep this in mind. And that was the point that I wanted to follow up on. Thanks.
Thank you very much. Just would like to
Two points connected to the previous discussion. I think, can you hear me online? Yeah. Okay. I think sometimes we should also be happy to see no effect of products. And what I would like to say with that is that some products, some feed additives may also work as kind of insurance, that they do not always have an effect, but in case that there is some pressure, that then they should be effective. Whereas the products that we have been used to, including antibiotics, we are used to have always a certain effect. So that's one thing that I would like to address. And the other one is that I think it's very important that we have very solid research on alternatives for antibiotics. If I look from an industry point of view, talking to a lot of different people, everyone has a solution. But if you look for the substantiation of this solution, and if you look for the solid science behind it, then it's often very poor. So I would very much stimulate good research programs on alternatives for antibiotics. From my point of view,
I totally agree with you. In fact, if we think about antibiotic products need to be licensed and with a lot of trials, so we know a lot about it. And sometimes with the alternatives, there is some small trials that know really enough underline. Maybe sometimes also the analyses are not so good. So it's really important that we define also how to register these additives, and maybe this is a lack in the law, because we need to be more on the point with these products. And regarding your first consideration, regarding sometimes we have no effect, and that is good. We have also to underline that sometimes with antibiotics we have also some effect that we couldn't like. I'm thinking like amoxicillin in the gut. So we use it maybe to control Streptococcus suis or in general gram-positive, but we have a very bad action into the gut, because we have several populations of gram-positive that are useful for our gut, but this product can kill them. And so if you are not using in the right way, you have a double problem. One that you had before, and the second that you create with the treatment.
First of all, your first point, Just, is, I think, in my view, identical to what Salvatore was saying. It's about dysbiosis, and it is a very important point. I wouldn't agree more with that. The second one, what worries me, because I come from the antiparasitic as opposed to antibacterial side of the equation. What worries me very much is that a lot of the claims are made on in vitro experiments. And when you try to translate these in vitro concentrations into in vivo concentrations, it's practically impossible to achieve that. And I was wondering, the research that you are calling for actually includes that people should be very careful not to extrapolate conclusions from in vitro into in vivo situations.
I totally agree with you. Sometimes what is clear in vitro is something different in vivo. But something that I would like to add and also to suggest to you that most of you are researchers, is just to consider something that comes from the field. Because sometimes we are always looking science that brings things to the field. And sometimes we are using some things in field that don't have a real base, a scientific base, but they help, they have an effect in the field. So sometimes I think also we need to consider something that is common and that we are doing as practitioners in field, that find a way why it's working, because it's working. And so sometimes I think, and this is the way that the practice and the science need to work together and exchange experiences, because this is the way to solve the problem.
You have two questions.
Hi, Gregory.
Hello, Giovanni. Hello, everybody. I'm greeting you from Belgium here. I'm a vet practitioner, more in bovine medicine, actually, but I also work now part-time in a company that's called Probiotic Group. So that's why I was interested by the topic here. I just wanted to bring something into the discussion, maybe, that the use of probiotics is commonly, and also here in the discussion, I have the impression, is commonly reduced to oral administration of probiotics or in feed additives. What we are actually working on and looking into is also the managing of the microbiome around us. Let it be on surfaces like the floor or whatever, and also of course on external the skin, of course, of the animals. And I must say we have pretty interesting results there. We already have cleaning products that are tested also with the University of Luxembourg, and yeah, the probiotics we use there are mainly from the Bacillus family, and that are actually bacteria that come from nature, from all around us. And yeah, they kind of, yeah, just say it simply, it's the fight between the good bacteria against the bad bacteria, and that's how actually the surrounding of the animal can be more healthy and less threatening. And of course, then in a good condition of the immune system, it all brings things into balance, and can definitely, in my opinion, have a positive impact. So just to open maybe the discussion of future research programs also on external probiotics use, just not in the gut or ingested ones. That's just what I wanted to point out. Thanks.
Thank you, Gregory. This is exactly what we are looking for, and we are discussing about that, because sometimes are probiotics, sometimes are bacteria, sometimes are something that they come from flowers, on grapes, from example that Marta showed us this morning. So this is exactly the way that we are looking for, but we need to have some to be sure that they can really help us, and in some condition that can help to reduce the use of antimicrobials, but also that we can have less diseases. Marta, would you like to add something?
I'm not sure if I'm listening to you very well. Is my time?
Yeah. If you like to tell something.
Okay. I just wanted to add a couple of things regarding the alternative to antibiotics that you are talking about, because there is a problem, as all you said and considered, with a lot of sides and angles, and it's very difficult to approach all of them together. But when we are antibiotics, I think that all of us agree, or all of us agree, and they are necessary, and they should be used in a correct way, and with they have to be used properly, but they are necessary, of course, when the illness is already there. But there are they look for mainly for a bactericidal effect, but there are other ways to fight against bacterial attacks. I am talking mostly about bacteria. I know that there are other microbials, but in bacterial attacks, you have enzymes, you have biofilms formation, you have, let's say, some virulence factors that bacteria use before even become a big problem. So this alternative, I wouldn't say alternative to antibiotics, but alternative strategies to fight against should probably go against these virulence factors, trying to avoid a worse situation. So I don't say that polyphenols, for example, which is our expertise, and I don't say that are better or either equal to antibiotics. Every kind of compounds has their own role. And you can use like probiotics or prebiotics, you can use first or at the beginning or in a preventive I don't know, a scenario. But when the illness is there, of course you need the antibiotic. So I would never think an alternative, but a complementary compounds or I don't know, or arms, or whatever you want to say. So like biofilms, like the pipes that we were talking about before, these pipes that are contaminated, bacteria has to first make a biofilm in order to then reproduce themselves and make a big contamination to the water pipes. If you avoid the formation of this first step of the biofilm, then you have a battle won already. Well, and I don't know if this is having an interesting point of view for you, or it's just a crazy idea. Thanks.
Marta, for your comments. We are totally agree that we cannot avoid the use of antibiotics, but there are several moments that we create a disease with a wrong management, with not right things that we do in the farms, and so sometimes this product can be helpful to prevent that are not really a disease that derive from a very virulent E. coli, but maybe is an E. coli that is not really dangerous, but you can see diarrhea because maybe the temperature is not adequate and they cannot eat in the first days after weaning, and then they start to eat too much and so on. But let's go on. Bas, would you like to add a comment?
I was a bit triggered by the remark that Joost made that a lot of these products that we use are actually not doing anything if the situation is okay.
Like
So,
a vaccine.
sorry?
Like a vaccine.
Like a vaccine, yeah. Right.
Yes.
But what you ask yourself is when you try to prove that these products might work or might not work. Killing me. But if you want to know whether the products work or not work, you would like to have a sort of challenge model or a sort of model in which you can test these products. Because I've also done a lot of research in which I didn't find a result, although in the literature you find effects. And of course, if the situations are okay, we don't find effects, and that's always our excuse why we don't find effects anyway. But what would be an ideal model to test these products that are around?
That's a very good point, because sometimes it's quite difficult for antibiotic. We look if it's killing or reducing the amount of bacteria, and that's quite easy. We know the way. Sometimes in these products, we don't know the way, because maybe the pig can grow a little bit more, maybe it can have a better conversion rate or something like this. So we have several points to analyze. So I think this is a way to look for, also to evaluate the way how to consider this problem. Ed would like to take the floor.
Yeah, a little bit of a change of subject. We're talking about finding alternatives to the use of antibiotics or antimicrobials. And the reason we want to find alternatives is to decrease antimicrobial resistance, coming right back to the fundamental. So what we need to be sure of is any alternative that we use does not promote or protect antimicrobial resistance to bacteria. And we know that antimicrobial resistance has multiple modes depending on the particular genetics of that mechanism of resistance. So, for example, there are mechanisms of resistance which are broad spectrum, such as a decrease in the porin size, the protein on the outside of the eukaryote, which allows entry or exit of the antibiotic to and from the cell. For example, there are non-specific active transport pumps which pump drugs out of the bug. These are non-specific protective mechanisms. And if we have any alternative product, which is a xenobiotic, which is foreign to the bacteria, it's likely to continue to promote the maintenance of that antimicrobial resistance, because the antimicrobial resistance isn't targeting antimicrobials, it's targeting any foreign molecule that gets in. So one of the things we have to be really careful of is if we're developing alternatives, and I'm not talking about probiotics here because that's a different category. If we're developing small xenobiotic molecules as an alternative to an antimicrobial, we have to confirm that it does not actually promote generic antimicrobial resistance.
Sorry, Mia.
Thanks for your comment. And Salvatore, I'd like to.
Yeah, sorry. Yeah, that's actually very interesting. And so I had a point to the previous conversation when we said we will never treat currently a disease with an alternative to antimicrobial because those are for preventative measures and so on. I think that is the mindset that we ought to probably reverse in the future and the following years. And that is by researching how the mechanism of action is actually happening at the molecular level for the alternatives. So we know, for example, for some of the methods that we have in trial, but also other researchers have been trialing in the past, there is a reduction of the MIC, and that is the first effect that you want to see over certain strains that are of danger for the animal, which could be used as an actual alternative therapeutic one. The problem is that we need to find out how that works. Connected to the point of the resistance, that is actually the main point, because antimicrobial resistant genes were found in the permafrost. So they were there before we actually knew about them. And is representative of what it could be called an immune system of bacteria. And therefore, no matter what we try and shoot at them, they will find a method to bypass that system. So I think that the combination of finding new alternatives, finding new methods, but also strategy of alternating different type of approaches would be probably the way forward from now, because I don't think we will bypass at all the antimicrobial resistance as a problem, but that would be something that it would be there by using something else as well.
Would you like to add something more?
Sorry, I missed that.
No, I think it's historical.
She forget the raising hand. Yeah.
I'm quite surprised that we haven't yet talked about vaccines. I mean, yeah. I mean, there are a few other vaccines that already exist and are still being developed on farms. That's it's very tailor-made solutions. For example, regarding Streptococcus suis. I mean, vaccines already exist. There is always a risk of mutation regarding antimicrobial resistance, but it's kind of rather reliable, I guess. What do you think about this, Santi?
We've had coronaviruses in our animals for decades, and we've never been able to get an effective vaccination. For example, feline infectious peritonitis or diarrhea in dogs. But when it became a human pandemic, it only took 3 months for the mRNA approach to be able to generate an effective coronavirus vaccine. So we now have new molecular tools, and we have a global industry developed for one pandemic, which now needs something to do. So let's get them on to some of the really important epizootic or zoonotic or economically important veterinary diseases, because they've got nothing else to do now. They're all geared up right at the moment. But the race is over for that coronavirus vaccine, but they've got the mRNA technique, which allows for that rapid change of vaccine for rapid change in pathogen. It's a really good opportune time to go down the vaccine path.
I think more comfortable speaking about vaccines because they are more close to my daily work. And maybe what you add is very, very interesting, because to develop a vaccine, normally you need 10 years. So you develop, you have to register, to do several trials. You need more or less from the starting moment to the moment that the vaccine goes on the market, you need a huge amount of time and a huge amount of money. So that's the way why also the big companies that are producing vaccine are looking for other business at the moment. But the way the bacterial vaccines are not so developed, and maybe sometimes they are quite easier if you use auto vaccines, that they can work very, very, very well. Maybe we need to look a little bit on the law that regulate these auto vaccines, because it's not very similar all around Europe. Jos, would you like to add something?
And not about the vaccines, because I think it's a very inspiring idea, especially because the capacity is there. But I was also wondering about phages, bacteriophages. I haven't heard about those today. I was wondering if anyone has experience with that, or has some thoughts about using bacteriophages as alternatives.
From my point of view, I heard something, not really in depth, but it's something that someone is developing, because it's a way to find the bacteria. So that could be, but we need to learn how to manage. But there are some companies that are working a lot on this topic. I don't know if you know something more than me. If nobody would like to add something, just to put one point that 1 minute.
It's almost done, yeah.
Please.
It's almost done already.
Yeah, almost at the finish in a couple of minutes. If 1 minute, one thing that we need, we don't speak is the disinfection. Maybe this is one preventive way, and we have also to point that sometimes we are not working in the correct way on disinfection, because we spoke about the biofilm in the pipes. Maybe sometimes using a disinfection and cleaning the pipes would be better, because it's a prevention way that reduce the bacteria that we are spreading among the farm. So I would like to suggest to you also to think about biosecurity, and don't forget that biosecurity is related to the behavior of humans, and is the most difficult things to change.
So underlying your point of view, so from the farms that we visited during the SFF project, coming back to the basics, we're splitting farms how to really decrease the antimicrobial use. So it's like farmers are getting used to practices, but sometimes veterinarians maybe come back to some basics like disinfection protocols, and when they come back to these basics, the situation already improves. So we're taking a lot of progressing, making improvements. So then just coming back to the basics, the strong and solid.
And it's something, it's quite easy and not cost too much. And so don't forget the basics, because sometimes we are thinking to the moon, but the solution is close to our teeth. So 4:26, the time is over. I would like to thank you very much for this session, and we will see after the coffee break in the other room and also in this one for the next group of discussion. Thanks a lot to all of you.
Okay. You have a free rein to develop an early warning system. What would you like, but think about it better from a farmer's perspective, what would you like this system to be, or the characteristics of this system to be? Yes.
Partly to be cameras that work for poultry industry. So I think simple RTB cameras will be great.
Okay, so simplicity is the first issue.
Yeah, because it's also correlated with low costs.
Yes, and it's also correlated with ease of handling because the information that you generate. Yeah, okay, excellent. Any other things?
Robustness.
Robustness, obviously. Let's not forget the basics. Next.
Cleanable.
Okay, so maintenance. I was reviewing a review paper last week about the cow feed intake systems, and the major issue about their success, because most of them have failed when they're applied on farm, is the cleanability. You cannot clean the camera, and that's a major issue. And I'm told actually, but people can contradict me obviously, that one of the reasons that Dynamic, I don't know if people are familiar with Dynamic, which is an activity system for poultry, has actually failed because of the cleanability. Okay, so simplicity, robustness, maintenance, anything else? Yeah.
I don't know a single word for it, but when it's in the experimental stage, it's still okay that it's an independent loose system that you can look at. If you're going to implement it on a farm, it needs to be part of the overall monitoring system of all the measures and all the thermometers and all the ventilation rates and the whole thing. You need some sort of plateau or platform where the information on what's happening in your barn comes together. Integration.
I think integration would be a nice word.
Yeah,
thanks, Ted.
I was looking for the word, but
yeah.
That's in the future. It needs to be integrated, otherwise it's not going to happen.
Okay. Anything
else?
else?
My 5 remote controls that I have on the dish in the living room, one for the radio, one for the. You don't want that.
Well, as you know, Microsoft is working on that because that's Bill Gates' hate. He's working on one now. Yeah. Anything else?
I think a quick training of the model and would be nice.
What do you mean by quick training?
Because it is, we used a lot of supervised learning systems.
Okay.
So quick training would be nice and also be trainable again and again and give us.
Okay, so one would be the operation in real time. Would that cover what you say? Yes. Operation in real time. And the other one that you say effectively is trainability, because you mentioned that on farm.
Exactly.
Yeah.
On the specific
Yes. Yes.
Farm. Because even lighting may affect a lot the effectiveness of the system.
Absolutely. And this is one of the major issues of the 3D cameras. They have major issues about light sensitivity. Anything else?
Something in the chat.
Yeah. Can I say one? The elephant in the room, but nobody mentioned it. Cost.
No, it's nothing.
Okay.
Something. Someone.
Okay. Somebody. Well,
Ask Mary to speak a little louder.
Okay. So you don't think cost? would be important. It's quite, yes.
Yes, but regarding the cost, is very important at the beginning. Just when you are applying the electronic system, are costing less and less and less. So the very big problem is how to spread the farms, because when you have something, you can think to the phones, for example. At the beginning, the phone cost really a lot. Now all the people have a phone, and it costs really less, and you can provide it for very less cost. So the cost is really related to how you can spread it around the
Yes, I mean, this is, it's quite interesting because last night we had this discussion with Ted, and initially, if somebody tells you to do a technology and to apply, to purchase, the initial cost is quite a lot, and that's usually a bottleneck because people don't consider that, because you tell them, for argument's sake, this will cost you 2,000 euros. But they don't think that actually in a year you might have paid off that, and then you effectively benefit from it.
That's what I was going to add.
Yes.
It's not just the cost, it's what you get from it as well. It's the benefit,
Yes.
it's the ratio between those two.
Yes. So that's great.
return on investment.
The return on investment.
Yeah, the return on investment. Excellent. Okay, yes.
I would add the objective acceptability maybe by the consumers also. Technology has to.
Okay, that's a difficult one, I think.
Yes.
Because I don't know how people, what is their experience. I have had experience when I go and make presentations to groups that include consumer group representatives. One of the things that they tell me is that they're concerned actually, and Hans will have certainly a view on that, it's that, that we are relying too much on the machine to make predictions of animal welfare. Okay, so that's what you have in your mind. What is your experience, Hans, of that situation, that people seem to be skeptical that a machine actually can make decisions about animal welfare?
It's not just animal welfare, I think that's in any line of business, I was going to say, but any important question that you have about the things that you work with. People are always skeptical in the beginning, and you first need to demonstrate that what you produce is effective, reliable, and then the skepticism will go eventually.
Yeah.
And I share my experience because I come from industry and I perform gate scoring. I have to do gate scoring, and when I have to train workers to do gate scoring for me, we might have developed the same criteria, but even we have a group of 100 birds, we will produce different results. But with machines, the criteria is as much as, how to say in English, in the orthopedic mechanism.
Yeah, as objectively as possible, yes. I will tell you then an example, but just.
I think it's also important to have some transparency about data ownership, for example. So you're collecting a lot of data, who owns the data, or where will the data go, where will it not go. So I think that's also very, very important.
And you have also historicity of the data.
Yeah, I suspect that this is also related not only to ownership, but vulnerability to cyber attacks and things like that.
Yes, but also if there are some welfare issues,
yeah,
in the production facility, who will see that on the one hand, and on the other hand, I think it also relates to the business model behind it. So who's having kind of business model by using data? Is the farmer only? Is the supplier?
Yeah.
So these kind of.
I mean, Anne was mentioning last night the example, the feeding companies cyber attack. How many cyber attacks you said that now they're having in France?
I don't want to remember, but there are many more than before.
Yeah.
And now it takes time for this company to, for example, to order the truck to go to the farm for the feed, because everything is
a bit louder.
Yes, everything is broken in the computer, and they have to manually the order of the truck.
Yeah,
that's the risk.
You asked for obvious things as well. The cost is an obvious thing, and we forgot. I have an obvious thing also. The system might be as reliable, you know, as you can make it. It may be very reliable, and you may completely depend on it. But the eye of the farmer stays very important in monitoring the welfare of the animals. So the obvious remark I'm going to make is that you cannot fully rely on automatic assessments or whatever. You also need to be there as a farmer every day. And maybe this remark belongs in the other room, where they talk about stockmanship, but I just thought I'd...
Okay, yeah, that's a fair point.
Connectivity is one issue.
Yes, these are the issues, but that relates actually, I put it here when you said, yes, yes. It's obvious, yes, absolutely. Any other points? Any points from the people who are attending remotely on that? Okay, I will give you an example. I don't know how many people are familiar with the work we did on the automated detection of pathologies. So what we did, we were detecting pathologies in pig carcasses at the slaughterhouse. And we had to annotate, as it's called, so we had to effectively train the machine to learn what the pathologies were. We used 3 different veterinarians, and at the end, the machine went up to 82 to 84 accuracy. And I remember when I presented it to the Pig Veterinary Society in the UK, they said, well, that's not very good, it's at 84%. And then somebody at that meeting stood up and he said, well, I will give you actually the number of agreement between veterinarians who do the assessment. And that was 66. I thought it was relevant. Anyway, okay, I started with my 2 points. Any other questions that you want to raise about the early detection, which are relevant? For example, Julia, you have the experience, because there are quite a lot of people here who come from the pig side. Do you think ever that for the chickens, we will move to the individual identification?
It might be really good, but I think it's very hard for poultry to detect individual chickens. So it's not useful because you have just one chicken as you have a big barn. So one chicken is in this corner and the other one is 100 meters far away. So you have 2 chickens there. I think it's not useful because I can't imagine that one machine can detect this both. So I think it's better to have a dynamic system for the group. So yeah, and there is a system that can identify specific birds and can follow their trackers. It is under investigation at the Wageningen University. It is, I think, it's Tick Track. The name has chicken. Tick Track. Yes. And,
okay. Do you know about that? No.
Yeah. I can. The University. University. I have also the paper, and I have made a presentation on it for the Bologna University. And it is available using Yellowify technology to identify specific birds, and then by using Kalman filters, it can follow the trackers of the bird. And we take a lot of information from it because the way the birds within the with its group says a lot of things about the environment.
Yeah, absolutely.
Yeah,
nobody's disputing that. Yeah. Yeah. Okay. Ted.
We've talked a lot about early detection of disease or abnormality. What Urani told us earlier, though, is I think the practitioner would like to have an early, short detection of what is the pathogen and what antimicrobials is it resistant to. You know, quantitative PCR on a chip at pig side.
Yes.
Let's be pie in the sky.
No, I don't think it's pie in the sky. I think that at least that was always my vision, My vision was that, and then I have my third question, which relates to that. My vision was actually, it tells you that you have a problem, you go to the pen, and then you use a pen side diagnostic, there and then tells you whether it's, and I think there are, I mean, Zoetis, I think, for example, has such technologies for pen side diagnostics. I mean, it's, which are based on non-invasive, even on saliva or feces or things. I don't think it's a pie in the sky, actually, and this should be our vision. That's in my view. Okay, any other points that you want to raise in relation to the PLF, but not the PLF only, because early warning, the bottlenecks. I have one question, but I don't want to monopolize the questions.
I also have one question, because we talked about behavior of animals, talked about sound, for example. I think there are also some techniques that could be interesting for odor compounds. So if you have early detection of disease by smell, so to say, by detecting odor compounds. And I'm very curious if any of you have some experience with that, and if you think that could be a promising route as well.
I have some experience, not in the development, but in their application. We have not developed that. We have collaborated with a company in Britain which develops a variety of sensors for different compounds. And they claim, whether this is true or not, that they can associate different compounds to different pathogens. That's what they claim. Interestingly, the program, they had a very huge program of research, and then COVID happened, and they got huge amounts of money to apply the technology to the detection of COVID, which is quite interesting, actually.
University of Blacksburg, Virginia, Maryland, has got dogs that can detect.
Yeah,
COVID
yeah.
people.
But the principle is that like all living organisms, bacteria as well emanate organic compounds. So in the UK, the companies, because that's what I know, but I suspect everywhere else in Europe and beyond will have this kind of things. Now, the major issues for that, from my understanding, is the application on farm, because all of them have been very successful on a small scale operation. The question is, when you have a pen of 20,000 chicks, where do you put it? And of course, the next question is, how many do you need? And do you need so many of those kind of things? Yeah, but yeah, the technology is a very important one to face. Yeah.
One comment, we are thinking something that is very important, very difficult to apply, but sometimes if we can measure every day in the same group the amount of the water that they can take, the amount of the feed, some indication we can have. Maybe something that is freely available, and if we can consider the temperature of the room that we have in every, more or less in all the rooms, that if we can consider all the things related to the animals, we can have some ideas without spending so much money. So maybe, as we told before, we have to start again from the basics and not only look at animals, but to look all the tools that they use to live in a farm.
I think that's very important. It's a very important point that sometimes, because you need some kind of set of sensor, and people think sometimes very fancy sensors. You don't need to have, it's just a water flow meter, which it is a sensor still, but it's something, a very cheap technology and very easy to implement. I couldn't agree more with that.
There are several publications.
Yes, precisely. Yes.
Just during the health semester project, we had many questions. One of them was what is an early detection, Is it a detection 1 or 2 days before the onset of the disease, or is it a detection the day of the onset of the disease, or maybe 1 day or 2 days after? Because if we consider that the farmer came once a day in these facilities, maybe that an early detection, in fact, could be something that can alert the farmer when the diarrhea is still present, but the farmer hasn't seen the diarrhea. And it was at the end of the project, our opinion was that it's already good to have an early detection when the clinical signs are present, because it's better than what do the farmers actually.
Yeah, that I agree with that. Yes.
And in his work, it was mentioned the sound dog. If you can see the data of the sound dog, you can have some ideas that something happened.
Yes.
Before that, a stockman can tell you, okay, we have the problem. So you have to think normally how is the situation. So you have a farm, you have a problem, and maybe that day the stockman is not entering in the room. So you are losing the first day with a high level of clinical case. Then the day after, something is really going wrong. The animal are not eating, they are lying in side and so on. So they are calling the vet. So the vet is coming not that day because it's too busy, and in a couple of days. So we are treating animals 7 days after the problem.
Yeah,
more or less. Something like this, when you have on your phone that, okay, let's control that there is something that is wrong. In a couple of days, you can go there, and maybe you don't need to treat with an antimicrobial or just with an anti-inflammatory, because you are at the beginning, and so you are not waiting. And that could be enough, from my point of view, to reduce all the big amount of antibiotics that we are using. So one day before or after, it depends from the tool that we have.
What it used to be called when I was a student, it was the Saturday or Sunday disease syndrome, because your staff is not present, or you have significantly less staff on Saturday and Sunday. So on Mondays, always the incidence of disease was higher than the rest. Okay. One more question, I think related to what you said, Anna, actually, that I'd like to pose, and was part of my talk. Think about it, the approach that we took in healthy livestock was a two-pronged approach. We had one approach that dealt with genetic changes in behavior. Yeah. This, although it's an early warning, it tells you that you have a problem, but you don't know what the problem is. Okay, that's one way. The other approach you can have is actually you have a specific problem. So for argument's sake, it tells you that you have Auzeski because that's the pattern in the behavior that has changed. What preference do you have? Because the two require different efforts to develop them. Yeah.
I think what we need is something that I want for my farms, that the farms that I work for. I think that we need an app, and this app should interconnect all sensors, even if they have different technologies. Then we can get all messages. So we have the cameras that says that the mobility of the flock is low, but if I have also sensor for the water that tells me that the feed and water ratio has changed dramatically, then I know that the emails that I get might be attributed to, I guess, gastrointestinal problems. So an app like this may be decision making and troubleshooting. Okay. So we need interconnected sensors.
So machine can help the vet and not do the job of the vet.
No.
I don't think, yeah, I don't think the machine will ever do the job of the vet, but to help him or her as much as possible, that would be the point. Anybody else on that? on the specific or generic? Because Maria, of course,
both.
yes, because obviously the more sensors you have, the likelihood that you will have a more specific diagnosis is higher. Now, the question, of course, is that if you have many sensors, A is the cost, B is the connectivity, C is the interpretation. Please.
I think you need to shoot for the generic mostly, because in these industries, it tends to be veterinarians who are specialised into those industries. So they have much deeper knowledge and can make those differential diagnoses once they're alerted to the medical problem. They can make those differential diagnoses pretty smartly and quickly because they're so knowledgeable. But it's getting them on property in time.
Okay, yeah, that's a very good point. I'm keeping notes because I think that they're very useful. Okay, any other points you want to raise? Look, you have, sorry for putting you on the spot, but you have the experience from the pharmaceutical industry perspective. Do you view, because one way that you might say, if you are cynical, that using an early detection system, it will reduce your sales of medications. But what is the view of the pharmaceutical industry about these technologies?
Well, our customers are farmers. Their main objective is to make money and be profitable. So early detection, reduces their losses. So we want to help them do that.
Okay, so it's a win-win situation, basically. Okay. Any other issues from your experiences with this kind of systems? I have worked quite a lot with what we call fancifully pathogen-induced anorexia, which is the reduction in the food intake at the early stages with the infection, and usually you don't see clinical signs. Now, in that respect, and I think you mentioned it briefly, what you might also see is that you don't see initially any change in the food intake, but you see changes in the patterns of the feeding behavior, okay? And you can imagine, of course, that if you are lame, you don't go to the feeder very often, you go to the feeder twice, but you eat as much as possible, yeah? So that has a diagnosis. And I have been working on that, on whether you can use the pathogen-induced anorexia as an early detection system. But this requires, of course, to be able to do the things that you are doing with the feeding behavior patterns. Okay. Yeah. Okay. So how much time have we got? 2 minutes. Any burning questions? This is your opportunity.
Were we supposed to talk about specific medicine? So?
No, we're not. Yes, but that relates, of course, to the things that Alain was saying. It's yeah. Okay.
Yes, just to have maybe a specific diagnosis could be useful for farmers to know how to react in front of the pathology. For example, if a calf monitoring system, calf coping, yes, monitoring system, could help the farmers to know if it's a viral or a bacterial disease, it could be very useful. For example, considering the way of the coughing, if it's a night, if it's a day, if it's very contagious or not, with the monitoring microphone, it could help us to say, yes, it's rather influenza, it's rather mycoplasma or actinobacillus, or things like that. Okay, in this case, you use aspirin anti-inflammatory. In this case, it will be more antimicrobial, antibiotics, and it could be useful also to decrease antimicrobial use, not to use them against a viral disease.
Was that, has anybody worked with sound talks? Because that was one of the principles of sound talks, but I don't know what they have done.
For the moment, I think that no, because they are trying to specify the disease that it's on progress.
this tool need to be managed in the right way, because the different coughing can give you an idea, but it's not a diagnosis. So be careful on that, because after you need to treat, and you have to demonstrate to the official vet that you have done the right choice. So this is my perspective, but sometimes we are thinking that all the machine can help us, but at the end you need to have a diagnosis, and sound is not a diagnosis, is something that take your attention and provide this attention of this, and analyze also the why you have cough.
It's exactly what Ted said and the others said as well, that you have very highly specialized vets who can tell you actually from the pattern of coughing, when you look at the pig, how it coughs, you can make a diagnosis. So yeah, my view is that exactly what you said, that you can actually raise the problem, but then leave it to the specialists. I think it's
an aid.
Yes, it's a tool. Yeah.
Something that can help you.
The question, could BLF tools become mandatory to ensure the implementation of European legislation for animal welfare?
What an important question. This is a hugely important question, I think. I obviously don't have an answer, but it is because it could become part of almost a biosecurity plan, because you have to have something like that to detect things early. Yeah.
Or even having a certifying body for animal welfare, but a reliable one, not, maybe from the European Commission, having a certified body for animal welfare, and then biosecurity could be there integrated and have, an holistic approach about animal welfare and biosecurity, and also label our products, and then it could be also beneficial for us economically, for the industry.
I think these are very, very important questions, and they have some actually they have some implicit philosophical issues in them. It's not only scientific. Sorry, I have forgotten all about the specific medication, but there you are. I'm totally prejudiced. So let's go and have a drink now. Is that the idea?
Yeah, we'll just come back in the main room first.
Okay. I'm sorry that you cannot join us for a drink.
But yes, thank you very much for
Okay.